Hello everybody, Adam here again, and I'm just going to answer one of the common questions we get in our office, and that's why would a pregnant woman see a chiropractor? I don't know what it was about last winter into the early spring, but we're having a lot of pregnant women in the office right now, so I think it's a great time to answer this question. These right here are pregnancy pillows. And there's obviously a cutout through here, so it makes it easier for pregnant women to lay on their tummies when they're in here. Also, if they get really big, then the table can drop out for more comfort as well. But what I want to talk to you about today is what brings them in, and that's typically pain or discomfort. That's usually the originating factor of why they come in. And I'm going to break it down very simply today to give you the biomechanical factors that cause that discomfort. But I'm going to give you 3 simple things you can do at home, 2 of which you need a partner to help you out, but they're really easy to do and they can give you a lot of relief. So first off, what happens during pregnancy? There's a lot of mechanical changes. We know that the belly gets bigger, obviously, as the baby's growing. There's the relaxin hormone, which loosens the ligaments in and around the pelvis and actually throughout the body as well. But what happens is when the baby's developing, we can start getting some pelvic tilt in there. So the pelvis will roll forward, and as a result of that, we'll counterbalance by extending back even further, right? Because we have to counterbalance that weight that's in the front now. So what ends up happening essentially is these joints that are called facet joints in your back get jammed together. So too much extension is a bad thing in the low back. So a lot of women come in complaining of low back pain, and one of the most common causes of that is this constant extension into these joints, causing them to jam together. So symptoms of that would be if you're standing for prolonged periods, say you're just working in the kitchen, making a meal or doing some dishes, whatever it may be, standing in one spot, you could feel this pain through the low back. It might even radiate a little bit out to the hips on either side, the glute area. The other thing is if you're walking, just being upright is going to cause more extension in there, and then you will get some relief by rounding your low back. So actually sitting in this case might actually be beneficial for you. So that's the number one reason why people come in here. The other area where people can get some discomfort is actually through the lower part of their belly, where basically almost into their groin. And one of the main causes of that is what's called the round ligament. So you have 2 round ligaments, one on each side, and they attach from the uterus all the way down to the pubic bone. So as the baby gets bigger, the uterus starts growing as well. There's more tension on that ligament. And that ligament can cause severe discomfort, and it can cause some shearing to the pubic symphysis here, which is a joint in the front of the pelvis that usually doesn't move too much. So if that's the case, usually light trigger point therapy in that area applied properly will cause that to calm down a little bit. Usually that's more common towards the end of term. But women can get that throughout, and you can feel the baby really kicking if you put pressure on that ligament properly. So those 2 things are the most common reasons why women come into our office during pregnancy. Now, the following is going to be 3 different stretches or exercises you can do at home, 2 of which you need a partner to assist you. So you can use your partner or you can use a family member. But I found that women that do this during pregnancy that have suffered, this can really help them to make their days and nights a lot more comfortable. So enjoy.
So the first 2 exercises will be partner assisted. You're going to use a support such as a chair, lean over that, extend your low back, and then with one hand you're going to have the support under your belly. The other hand is going to contact the top of the tailbone. That's in between the 2 points in the back of the pelvis. And then you can gently pump 8 to 10 times and do this as much as possible to get relief. The second one is you're going to find the lateral side of the pelvis, and literally what you're going to do is stand behind your partner or spouse, and you're going to compress those pelvic joints together because they're under constant strain. So this is actually going to give quite a bit of relief. Just make sure you don't put too much pressure right off the start. The last one is going to be the child's pose. This is something you can do simply at home. You're going to spread your knees nice and wide so you have a place to have your belly, and then you're going to walk your hands out nice and slow and controlled. If you can see, Krista's low back is rounded. This is going to open up those facet joints that get constant pressure on them when they're standing in that extended position.